In recent years, lifestyle medicine has emerged as a powerful approach to managing chronic conditions and improving personal health. It emphasizes the use of sustainable lifestyle changes, such as diet, exercise, sleep, and stress management. Unlike traditional medical practices that often focus on symptom relief and medications, lifestyle medicine addresses the root causes of health issues, encouraging individuals to take control of their well-being. Lifestyle medicine is significantly impacting personal health in chronic conditions by promoting lifestyle changes that address the root causes of diseases. This approach focuses on healthy behaviors such as improved diet, regular physical activity, stress management, and social support, which can reduce the incidence and progression of conditions like diabetes, cardiovascular diseases, and obesity. Moreover, it emphasizes a multidisciplinary approach involving healthcare providers and community support, making interventions accessible and often cost-effective. By integrating these practices into clinical settings, healthcare professionals can enhance patient outcomes and lower healthcare costs. 25. One of the core principles of lifestyle medicine is its focus on nutrition. Research has shown that adopting a plant-based diet rich in whole foods can significantly lower the risk of developing chronic diseases such as diabetes, heart disease, and certain cancers. Nutrient-dense foods provide essential vitamins and minerals that support bodily functions, improve immune response, and enhance overall health. Integrating colorful fruits and vegetables into daily meals not only boosts energy levels, but also fosters a deeper connection between food and health, allowing individuals to feel empowered by their choices. Physical activity plays an equally essential role in lifestyle medicine. Regular exercise is not just about weight management, it's a critical factor in reducing inflammation, lowering stress, and improving mood. Studies have demonstrated that even moderate exercise can have profound effects on cardiovascular health and insulin sensitivity. From brisk walking to yoga, movement becomes a holistic practice that not only strengthens the body, but also calms the mind, creating a balanced approach to wellness. Sleep and stress management are often overlooked yet crucial components in lifestyle medicine. Quality sleep is essential for recovery, cognitive function, and emotional regulation. Establishing a soothing bedtime routine and practicing mindfulness can enhance sleep quality, leading to better health outcomes. Moreover, learning stress management techniques such as meditation or deep breathing can mitigate chronic stress effects on the body, preventing diseases linked to stress-related inflammation. The impact of lifestyle medicine extends beyond individual health. It fosters community awareness and support. As more individuals adopt these healthier lifestyles, they inspire others to consider similar changes, creating a ripple effect. Schools, workplaces, and local governments increasingly recognize the importance of promoting healthy habits, which can lead to broader societal shifts towards improved public health and reduced healthcare costs. In conclusion, lifestyle medicine is revolutionizing the way we approach chronic health conditions. By focusing on sustainable lifestyle changes, it empowers individuals to reclaim their health, ultimately leading to enhanced quality of life. As awareness grows, the positive impact of lifestyle medicine will likely continue expanding, paving the way for healthier generations to come. Effective lifestyle changes for managing chronic diseases include: First, nutrition. Adopt a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Consider diets like the Mediterranean diet to lower disease risk. Exercise. Engage in regular physical activity, aiming for at least 150 minutes of moderate exercise weekly to improve overall health and manage weight. Stress management. Utilize techniques such as mindfulness, yoga, and meditation to reduce stress levels. Sleep. Aim for 7 to 9 hours of quality sleep each night to support overall health. Avoid harmful substances. Quit smoking and limit alcohol consumption to reduce chronic disease risk. To reduce chronic disease risk, focus on these key exercises. Aerobic exercise. Benefits. Improves circulation, lowers blood pressure, and enhances heart health. Recommendations. Aim for at least 150 minutes of moderate activity weekly, such as brisk walking or cycling. Resistance training. Benefits. builds muscle mass, reduces body fat, and improves cholesterol levels. Lifestyle recommendations. Engage in strength training at least 2 days per week. Flexibility and balance. Benefits. Enhances joint mobility and prevents falls. Recommendations. Incorporate stretching and balance exercises daily.